So I thought, God give me another chance. And so this is a situation when, you know, give me some sunshine, give me some rain, give me another chance. So this is a standard vitrectomy process in a macrohole surgery. So you have started initially, is a relatively young boy. So here they have a little sticky vitreous. So you have started digging after doing the core vitrectomy. So we have given triamcinolone and to stain the posterior cortex. And we are just trying to, you know, separate the posterior cortex from the retina. And during this process, you become little jittery that you are not able to do it properly. So you just again took a second chance, and then no, it is not being happening. So you took a fourth chance. In the meantime, our OT assistant, they have put some water over here, and yes, you could do it. You could do the PVD induction. You are very happy, but yeah. Then once you remove it and then see, you have created a large retinal tear during your last attempt, and you become jittery of not happening things. So you try to, you know, use your force little more, and then you were stuck. So this is we had to do a laser surrounding that area, which is actually not was not a very good day for that day. But yes, a simple macrohole surgery can lead to that kind of situation. This is another when you have a IOL drop in the vitreous cavity and you have started doing vitrectomy. You are relaxed that okay, I'll finish the vitrectomy and then I'll simply just take out this lens, and this is a 3-piece lens with scleral fixation. I'll just take the haptic out and then fix it into the tuck it into the sclera. So I'm very happy that okay, I'll finish it off this surgery as early as possible, and because that was a long day and just trying to finish, and then this thing happens. So here you can see it here. You have touched your retina, and instead of, you know, finish it off little early, you end up of having a lot of other complications. You have created a full thickness retinal break, then you have to do that laser fluid air exchange of supporting that retina, and even after that also this is the lower part of the retina, so you are scared that after some time whether this patient will develop. So when you have a life out of control, so we can put can you enjoy the music?
Yeah, the music is fine. Okay, we thought we lost the video.
So when this situation comes, then you just try to reverse it off. So what was actually you did wrong? In the first case, you had jittery that it is not happening, and then you try to do it little forcefully. You end up of having. Second one is a relaxed. I need to finish the case at the earliest possibility, and then you are in soup. So even the simplest, the take-home message is that even the simplest case also you cannot be relaxed when you are on chair. So like how to proceed about it. So if you are not able to with the sticky vitreous, or you have a vitreous, you know, having a vitreomacular traction, when you don't want to create a separate traction on the retina, especially on the vitreous at the macular area. So in this situation, we just try to, you know, clear the vitreous. This is the vitreous addition is more on the disc area and macular area. So what you need to do is you just try to separate from the disc area and the macular area separately. So there are two islands of vitreous sitting now, and then once it is separated, those areas you just trim it, and at the end this part you can do it very smoothly and separately, so that there is no extra traction on the different part of the on different part of it. Thank you Shujo for giving me